Cranial nerves are a set of 12 pairs of nerves that emerge directly from the brain and brainstem, rather than the spinal cord. They play a crucial role in transmitting sensory and motor signals to and from different parts of the head and neck. Here's a list of the 12 cranial nerves along with their functions, locations, related diseases, and common treatments. Olfactory nerve, eye. Function, sense of smell. Location, arises from the olfactory epithelium in the nasal cavity. Related diseases, loss of sense of smell, anosmia, due to trauma, infections, or neurological disorders like Parkinson's disease. Treatment. Treatment depends on the underlying cause, which may include medications, surgery, or rehabilitation. Optic nerve, 2. Function, vision. Location, arises from the retina of each eye and extends to the visual centers of the brain. Related diseases, optic neuritis, glaucoma, optic nerve tumors. Treatment. Treatment varies depending on the specific condition but may involve medications, surgery, or vision aids. Oculomotor nerve, 3. Function, eye movement, pupil constriction, eyelid elevation. Location, arises from the midbrain. Related diseases, oculomotor nerve palsy, which can cause double vision, drooping eyelid, and difficulty moving the eye. Treatment. Treatment depends on the underlying cause and may involve medications, surgery, or vision therapy. Trochlear nerve, IV. Function, eye movement, specifically downward and inward. Location, arises from the midbrain. Related diseases, trochlear nerve palsy, which can cause difficulty moving the eye, especially when looking downward. Treatment. Treatment depends on the underlying cause and may involve medications, surgery, or vision therapy. Trigeminal nerve, V. Function, sensation of the face, chewing muscles control. Location, arises from the pons. Related diseases, trigeminal neuralgia, severe facial pain, trigeminal neuropathy. Treatment. Treatment options include medications, nerve blocks, surgery, and alternative therapies like acupuncture. Abducens nerve, VI. Function, lateral eye movement. Location, arises from the pons. Related diseases, abducens nerve palsy, which can cause difficulty moving the eye outward. Treatment. Treatment depends on the underlying cause and may involve medications, surgery, or vision therapy. Facial nerve, 7. Function, facial expression, taste, tear and saliva production. Location, arises from the pons. Related diseases, Bell's palsy, facial nerve tumors. Treatment. Treatment may include medications, physical therapy, facial exercises, and sometimes surgery. Vestibulocochlear nerve, VIII. Function, hearing and balance. Location, arises from the pons. Related diseases, vestibular neuritis, acoustic neuroma. Treatment. Treatment depends on the specific condition and may involve medications, vestibular rehabilitation, hearing aids, or surgery. Glossopharyngeal nerve, IX. Function, sensation of the throat and back of the tongue, taste, swallowing. Location, arises from the medulla. Related diseases, glossopharyngeal neuralgia, tumors. Treatment. Treatment options include medications, nerve blocks, and sometimes surgery. Vagus nerve, cranial nerve X. Location. The vagus nerve is the 10th cranial nerve and is the longest cranial nerve. It originates in the medulla oblongata of the brainstem and extends through the neck and chest to the abdomen. Function. The vagus nerve has numerous functions, including regulating heart rate, controlling gastrointestinal motility, regulating sweating, and influencing speech production. It also plays a role in the parasympathetic nervous system, which is responsible for the body's rest and digest response. Related diseases. Vagus nerve disorders or damage can lead to conditions such as gastroparesis, delayed stomach emptying, vocal cord paralysis, arrhythmias, and some forms of epilepsy. Treatment. Treatment options for vagus nerve-related disorders depend on the specific condition. They may include medication, surgery, or nerve stimulation techniques, such as vagus nerve stimulation, VNS, using an implanted device. Accessory nerve, cranial nerve 11. Location. The accessory nerve is the 11th cranial nerve and has both cranial and spinal components. The cranial part originates from the medulla oblongata, while the spinal part arises from the upper spinal cord. Function. The accessory nerve primarily controls the movement of certain neck and shoulder muscles. It plays a role in head rotation, shoulder shrugging, and some aspects of swallowing. Related diseases. Accessory nerve disorders or damage can lead to weakness or paralysis of the affected muscles, resulting in difficulty moving the head or shoulders. Treatment. Treatment options for accessory nerve-related disorders focus on managing the underlying cause. Physical therapy and exercises to strengthen the affected muscles may be recommended. In some cases, surgery may be necessary. Hypoglossal nerve, cranial nerve 12. Location. The hypoglossal nerve is the 12th cranial nerve and originates from the medulla oblongata. Function. The hypoglossal nerve controls the muscles of the tongue, allowing for speech, swallowing, and other tongue movements. Related diseases. Hypoglossal nerve disorders or damage can lead to weakness or paralysis of the tongue muscles, resulting in difficulties with speech, swallowing, and tongue movements. Treatment. Treatment options for hypoglossal nerve-related disorders depend on the underlying cause. Speech therapy and swallowing exercises may be helpful in some cases. In certain situations, surgical interventions or nerve stimulation techniques may be considered.